Hey guys, so this is just a quick video to discuss kind of the concept we're talking about today, which is around kind of mechanical slings. So more often than not, when we learn anatomy, we typically look at learning it as a separate entity. So it'll be origin, insertion, atypical actions, and then innovation if you go into a little bit more depth around that. What we don't do really enough of, and this is something that everybody's guilty of across the world, is thinking of muscles as rather than just a single kind of unit on its own, thinking more in terms of groups as such. So whether you've heard the term as such as force couples or synergists, where they act over several joints. So this may well be something like the force couple of serratus anterior and trapezius acting on the scapula. It may well be subscapularis and infraspinatus and teres minor to cause an inferior glide of the humeral head on the glenoid, so to speak. It may well be you've got a synergist like in the shoulder again with regards to supraspinatus and deltoid, facilitating kind of rotation and lifting of the humerus during abduction. But there are a host of others as well. When I've looked at athletes and patients I've worked with in the past, if they've had a groin problem, I've looked at kind of the strength or activation of their opposite internal and external oblique. Sometimes it may well be they have a lumbar pelvic issue, something around, say, osteitis pubis or around kind of the anterior pelvis, that's then affecting kind of that pain. So in terms of they're coming to you with pain, but actually it's not actually coming from there. Remember, when you first come to university, Julian talks about the fact that the area of pain isn't necessarily the problem. So we're looking at kind of distribution of load, distribution of force, etc. If we look at the foot, for instance, then you've got obviously the likes of tibialis posterior and anterior forming kind of a force couple around kind of the medial arch. So again, there are a host of these throughout the body, and we need to start looking at kind of functional units. So in the next section, I'm going to talk about kind of global mobilizers, global stabilizers, and local stabilizers a little bit more, just to give you a little bit more of an appreciation and a background as to how these muscles function in real time. So although we're covering it today with regards to kind of trunk and pelvic stability, this has kind of far wider reaching ramifications with regards to your understanding of anatomy and how it fits into human function. Again, like with anything that we look at doing, it's all about building this repertoire. So this theme for kind of trunk or force transfer or pelvic stability, whatever you want to call it, fits in whether you're talking about athletic development, running mechanics, change of direction, back pain, so on and so forth. It's a tool for your toolbox. It just depends on how you utilize it.